Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Thank you very much for having me.
Yes, sir. Well, yesterday we had a milestone. We passed 150,000 persons would have been vaccinated. Well, as we go on later, we'll ask you for update of numbers for the ending of the day. But I wanted to talk about Monday, and we got some news that we're expecting a shipment of vaccines. Could you tell us about that?
Well, next week we're expecting a shipment of vaccines. Ones that we bought. So we're expecting more Sputnik V to come in next week. We are also expecting, if all goes well, another shipment of vaccines from COVAX, but we are awaiting the final date for that. So next week we should be getting in another set of vaccines to assist with our program.
All right. Do we have an idea of the number right now?
For Sputnik V, we are looking at about 60,000 doses, and for the COVAX, we're looking at 38,000 doses.
Great. I know yesterday we spoke about us having the second doses and so on, but before we perhaps mention that a little bit, could we talk about, do we have numbers for the ending of yesterday?
As of yesterday, we have we've exceeded about 154,000 first doses and more than 7,000 of the second doses.
All right. Thank you, Minister. All right. So we have some questions from Stabrook News. They're asking, has Ghana sent any samples for variant testing to CARFA or the U.S. Medical School that the ministry was having discussions with, I think, in March?
Yeah, so we're looking for avenues how we can test for possibility of variants, and we're still trying to work out those arrangements to see which lab would accept the samples and so forth. So we're yet to finalize those arrangements.
All right, but for now, those samples are still being
Yeah. What happened when someone sent in a sample and we test the sample here at the National Public Health Reference Lab? We are able to determine whether the person is positive, but we also store the samples in our facility, so we can always go back and select that sample and to do other tests with the sample if it's necessary. So we do have samples at the lab that we can check to see historically what it was and so forth. So sampling is not the problem, it's getting access to a facility that will do the sequencing, and we are still working on that.
All right. If I can ask you just a follow-up to that. I know initially we had spoken about CARFA, but I don't know if they're overwhelmed and that's why we're looking at other institutions. Can you say?
We're exploring the options. CARFA is one possibility, and other facilities, we are looking at that as well. The thing is that with the other facilities, you probably have to, you'll have to pay. With CARFA, we have an arrangement where these things can be done more or less free of cost. But again, it comes back to capacity, it comes back to being able to select, well, not select samples, but to get the laboratory to do the sequencing. And that's what we are exploring.
All right. Another question from Starbuck News. They're asking, are any of the recent COVID-19 deaths persons who would have received a vaccine? And is the ministry keeping track of that sort of information?
We haven't seen, well, let me rephrase that. We have been monitoring everyone who receive their vaccines, and we have been monitoring to see whether or not they get side effects. As far as I'm aware, I don't think we have had any cases of persons dying after receiving their full dose of vaccination. So that's something that we have been constantly checking. So once you have received your 2 doses, we haven't seen anyone who has received those 2 doses and dying from the infection. So that's a very positive thing. We have, however, as we have explained before, there are possibilities that after the first dose of, after your first vaccine, there there is still a possibility that people can get infected, and if they get infected, we don't anticipate they will have the severe form of the disease. We have had reports of a few cases like that, and we have tracked those cases, and we haven't seen any adverse outcomes. And those persons were able to get their second dose, and after the second dose, they did fairly well. So we have tracked those as well.
Right. And generally, you still have to look out for those comorbidities.
Of course, because if someone is generally sick because they have other underlying conditions, so they have diabetes or hypertension or heart disease or something of the sort, it will put them at an increased risk of getting COVID-19. And therefore, that's something that we look for. Persons who are older were also in the risk category. Fortunately, from the vaccinations that we have done so far with first doses, we have seen now that approximately 61 point something percent of the over 60s have received their first dose of the vaccine. So that's a positive. And we hope that the more people would come forward in that age group and get their vaccination. This would be a very protective kind of thing, because then they wouldn't, they wouldn't end up in the hospital because of COVID, or they wouldn't die from COVID. So that's a positive thing.
Yes. All right. So, Fabric News, the other question: what are the current treatment protocols for hospitalized COVID patients, and what are some of the drugs being used as part of the treatment? And they're also asking, is convalescent plasma still being used?
So about a month and a half ago, we had a training session, having completed treatment guidelines, standardized guidelines. These standardized guidelines were done with our clinicians plus the assistance of PAHO WHO. And having completed those standardized guidelines, we then held a training session for all the doctors who were treating COVID-19 patients. So in every region, we brought out people and had this training. It was a 3-day training session. So those are the guidelines that we are currently using. Now, our protocol, if you think about COVID-19, you can think about the severity of the disease. So you have persons who can be categorized as asymptomatic or mildly symptomatic. So maybe that can be like the first set of people that we can look at. Those persons generally do not require any sort of treatment, just that we know that they're positive, and what we advise them to do is to be isolated so that we prevent spread from happening. Then you have people who are moderately sick. They might experience some of the signs and symptoms of COVID, whether it's a bit of fever, some fatigue, headache. Some people might lose their sense of smell or taste. Generally, that's what you have. Some people might experience some challenges with breathing, but that's it. And then you have a more severe form of COVID, which then requires that person to become hospitalized because they're having difficulty breathing. And from the severe form of COVID, you also have a critical form where people would be placed in the ICU. So for each of those stages, the management varies. because the milder form don't require anything specific. Moderate forms, depending on the symptomology, we can add some medication. But once you start having respiratory difficulties, then you will need some form of assistance, and that's one of the main reasons why you'll be hospitalized. In the hospital, the treatments that we offered, the meds that we use can fall in a couple of categories. One, we can give antiviral medication, and that is to reduce the viral load in the patient. Generally, what we are using in Guyana is remdesivir, so that helps to reduce the viral load in these patients. Then, because of how the disease works, some people would start having their immune system would have this hyperreaction, hyperinflammatory reaction. And to slow that down a bit, to prevent organ failure and so forth, you would need to use steroids. So generally, those patients are put on dexamethasone. So we have those two medications. That's the hallmark of how we treat our patients. And of course, all the patients who require oxygen, because they're having breathing difficulties, we're able to provide that oxygen. So oxygen is one of the mainstay of therapy. That oxygen can be delivered in various ways, from just putting a mask over the person's face, to putting them on a CPAP machine or a BPAP machine, or putting them on a ventilator. And so there are different options depending on the severity and criticalness of the disease. So that's how we have generally approached it. Convalescent plasma is also being used, and convalescent plasma is generally, well, it's harvested from patients who have recovered. And the theory behind that is that a recovered patient would have antibodies in their system. And that's what we're really after, those antibodies. So we take that plasma, we transfuse that into a sick patient, and those patients then would have antibodies to help them to fight off the disease. So for some of the very critical patients that we have, this is a method that we have used of giving them convalescent plasma.
Right. Just a follow up to that, I know we have had a lot of support coming from the government of India, and then you've had UNICEF, and then, of course, the private sector in terms of those specific medication and equipment. Do we have any shortage, or do we have ample amounts?
Well, for these medication, the government of Guyana has been buying them. So dexamethasone, remdesivir, these are things that we have bought, and we have bought them in ample supplies so that our patients can get them.
All right, thank you, sir. We have some myth busters, and the first one we want to ask: traditional remedies, bush medicines, will they protect against COVID-19?
Well, you're hearing all sorts of things. If you drink this tea or that, it would work. The disease doesn't work like that. It's a simple thing. You have a viral particle, the virus gets into somebody. This virus has a very specific way in which it would attack the body. So if it got into the lung, it produces certain changes in the lung, and it would affect your breathing. And then once it gets into the bloodstream and circulates, you have a whole set of other problems that can develop. These problems range almost every organ in the body the virus can attack, and they have been clinically different manifestations of how this virus works. So you can have skin manifestations, you can have kidney, liver, spleen, brain, the gastrointestinal tract. So almost any organ system that you can think about in the body, the virus can attack them. And the symptomology depends on which organ is being attacked. So using bush tea and these types of so-called home remedies wouldn't solve the problem, because it wouldn't, first of all, it wouldn't kill the virus. Secondly, in most of these things, we don't know how they work or they don't work. And while there's an assumption that it probably would increase your ability to fight off viruses, there haven't been any clinical studies with any of these bush teas or anything to justify using them. There might be some kind of placebo effect that people might feel that, I drink this thing and I feel good, but that's not going to help you if you're really and seriously exposed to the virus. So what we need to do is to make sure that we prevent being exposed to the virus in the first instance, and to take the precautions like mask wearing and social distancing and so forth. And once we do that, it is going to help us remain protected. And if we are fully vaccinated, then you would have the means that if you're exposed, that your immune system would respond to this virus. So we have to stay protected.
Yes, sir. This next myth that we have, I just want to make it clear that we are not attacking anybody's belief or religion or anything like that. But this is one of the myths that we've constantly heard. God is in charge, and he will heal me from any severe form of COVID-19.
Well, I guess that's why, there have been a lot of researchers who are believe in God, and they have developed this vaccine. So it's a tool in our hands to prevent the vaccine. So maybe that's one way in which the Almighty is working, by giving us a vaccine that can protect people. And therefore, for all those persons who believe, then they should take the vaccine and use it.
All right. Thank you, Minister. Well, that's it for today's COVID-19 update. We, of course, just spoke to the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and, of course, our social media platforms.